Hello, Professor Frank. This is Group 7. Our project is on brain stimulation. First off, a little introduction. Brain stimulation is a fairly new medical practice that has proven to help patients suffering from various illnesses. Though the treatment has proven to work for some illnesses, there are several ethical issues to be taken into consideration. This is a serious new breakthrough that may change the lives of many who live with chronic mental disease.
So right here we have a timeline of discovery in deep brain stimulation for medical purposes. But please note that in the more recent years, in the 2000s, we've seen the most development due to the better technology that we have in the medical world, and that continuous advancements are being made currently.
Stimulation is the act of targeting various nerves, muscles, or sensory organs to release new activity within the neurons. Deep brain stimulation is a placement of electrodes inside the brain in order to control the non-responding neurons. Stimulation helps to improve the current conditions and also leads to a higher quality of life.
One of the discoveries being made right now is the iBrain. It is a device that is being created by Neurovigil, a company based in San Diego. What that is it's a comfortable headset. It looks almost like a headband with the wires in it that has the ability to read brainwave activity. Right now it makes it possible to control virtual objects and even physical electronics with little concentration. And what it does is it monitors brain activity and helps better understand how medicine works, as well as how it affects the human.
So the current state of development that this device is in, well, we've done some research, and at first it's actually entered the market in 2009, but previously in the years they were just researching and also developing new ways to find a way to enter the market. But mainly they're still in their testing phase. So it's currently not FDA approved, which takes years. Right now they've been working with scientist Stephen Hawking, and he has been tested lately because of the disease that he currently has and the knowledge that he also has. So they're working right now with him, and they've shown some signs of improvement with the product, but not enough for it to be approved. Here's a little quote by Dr. Lowe, which we found. He just mentioned that this is the first step in personalized medicine, so we can see the advancements of where medicine is heading, and also the ideas and thoughts that are coming into scientists and doctors as of late.
Did you pause it? Oh no. Benefits of these new technologies. Obviously, it helps people with diseases and mental illnesses. It can help for someone like Stephen Hawking who has ALS. It can help him communicate easier. Right now, he's physically unable to speak, so this technology could allow him to communicate with doctors. They would be able to monitor his brainwaves and then make prescriptions based on that. And hopefully, in the future, we'll actually be able to make out words in his head, so people will be able to understand his thoughts. The deep brain stimulation surgery, these procedures, if perfected, could allow patients to live a fulfilled and meaningful life where they're not affected by their diseases such as Parkinson's. The procedure has been able to slow tremors in people. It's also been able to help people with sleep apnea, depression, and it's been tested on OCD.
And also, just to touch up on that, before this product, if you were in the hospital, they would have patients staying overnight who would be, hooked up to a lot of wires and medical things. So basically, this makes it more convenient for anyone to control their brain activity while they're, at home, watching TV, sleeping. It's just a comfortable product, and it can be traced back to the hospital where they can monitor it. So this actually can potentially save costs and time and help the patients live a more convenient lifestyle as well.
negative issues related to this. Long-term effects are unknown, as it's relatively new, so we don't know how far it's gone in permanently healing people. We don't. It's not the and the post-operation requires constant monitoring by the doctors. Also, the cost of these procedures is unknown. We will not know who is able to get it or at what cost, and we also don't know who will be able to use this product, as there are many people now with various types of mental illnesses. We don't know if doctors will treat those with all kinds, or if they will take some more seriously than others, such as Parkinson's. We know right now is being treated one of the most, as they're seeing a lot of positive results there. So right now, that's one of the main ones. And also, just the hardware of the surgery. Right now, they're putting wires and metal in people's brains, so we don't know what type of side effects that could happen, as technology always has malfunctions. So that's a huge risk as far as placing those in somebody's brain.
And we just want to touch up on some of the ethical issues behind this device. Um, you know, is mind reading ethical? You could argue that for the fact that you're potentially reading their brain activity and monitoring the way that they're thinking and what they could be saying potentially. So it's kind of a touchy subject. It's definitely an issue that might be brought up. And if you can monitor these patients' thoughts, then who could actually gain access to this device? Is it safe? Are people going to be able to hack into this device? It's a scary thought. You never know with technology nowadays. Also, does it go against our own privacy? That's another question that we could bring up. There's no guarantee to this procedure, and some of the tensions might mount between wealthy people and lower class people who can't afford this product but might have the same type of diseases and symptoms as well.
So in conclusion, this idea is a breakthrough for new medicine, and it has the potential to help change the lives of people who struggle on a day-to-day basis. And it highlights the fact that technology continues to improve and advance, and the eye brain, as well as the deep brain stimulation, is a fascinating new start to where we are headed.